Those are like telltale signs or questions you can ask about if and when appropriate to help a female get the appropriate care, because again, these symptoms can be managed long-term. You don't have to be like a victim to your PCOS, because it's incredibly debilitating physically and emotionally for women. And I think if we can work together and give the women just a little bit of relief, it goes a long way for the quality of their life.
Absolutely. And I want to welcome Karen. Hey, Karen. Happy to have you today. So Karen's got a couple questions. So do you find women without a weight/metabolic issue, do they tend to be underdiagnosed?
Yeah, I think that's a great question. I've actually find both. I find them underdiagnosed because, well, you don't fit that standard PCOS, picture. Right. And that's where I say, what's going on? Find out about their lifestyle. Are they like type A, like I said, like modern female type A? Can you do a little bit of testing where you're looking at how their adrenal cortisol is functioning? Can you look at their micronutrients? So I do find that they're underdiagnosed, but I also find that providers are giving a lot of women the diagnosis of PCOS when really it's like, are you just overstressed? And do we need to work on some sort of balance there? Is your blood sugar just slightly dysregulated? So I hope that answers her question. I do find underdiagnosis, but I often find almost like using the label a little bit too much, to the point where we're totally ignoring the person and we're just giving them this stamp, and then they get a lot of fear around that and say, well, what's actually going on? You don't have a metabolic issue, but what is your root cause? Overlooking the root cause.
Okay. And then what are the questions we should have on our intake forms to help, to flag PCOS?
Yeah, really helpful. I like this question. So I would ask a lot about the symptoms. That's a great starting point. And if they answer yes to them, then you can do a little bit more testing if you feel comfortable, just some standard blood tests. But excess hair growth, you can ask about that on the face, the back, the chest. You could say excess hair growth. Where are you seeing it? If they're presenting in hormonal areas, do they experience adult acne? Are they having regular or irregular menstrual cycles? Do they notice hair loss? Are they noticing high amounts of stress? Those are some good questions to ask. Do they experience excessive hunger between meals? What is their fullness cues like? That's another player in PCOS as well.
Oh, interesting. Yeah, that makes sense. What about the anxiety piece? Yeah, tell me a little bit, like, where does that fit in? And I guess what's the reasoning behind an increase in anxiety?
Yeah, love that. So women with PCOS can experience more anxiety or depression for a few different reasons. Some could be because of the hormone imbalance, so the swings in blood sugar, the higher testosterone. It can make you actually a little bit more moody and cranky. Okay. But then we have to actually look at, the female as a whole. All of the females watching, I want you to think about it. Like, what would happen if your hair started falling out and you started getting a bald spot around the crown of your head? What happened if you started growing hair on your face, or you had acne and you had no idea why it was happening, or you had no idea how to fix it, and you're hiding, shaving your face behind your husband's back? I mean, these are things that these women deal with. So this part of the mental health piece of PCOS can absolutely be because of the symptoms. And there's a lot of pressure around women to be on diets with PCOS, to cut carbs, and that can cause a lot of anxiety. And women with PCOS are even more likely to have disordered eating patterns. So I'm really happy that we're talking about this, because something that I think is unique about my approach with PCOS with patients is, I'm not a therapist, but I keep in mind their emotional health, and I make sure that's being taken care of, because the disorder can be really, really challenging if you look at it that way.
They're getting hit from all angles, even disordered eating, which completely makes sense. So, oh my gosh. Really, I can't really think. Maybe there are more complicated disorders, but this has to be right up there in terms of kind of, unfortunately, just having such a wide range of really intense symptoms. Hey, Kim, welcome. So Kim, great question. Do you, so Eleni, do you use any Dutch tests? Do you use the Dutch test?
Yeah, yep. Especially when it feels, absolutely, when it feels appropriate, because you're able to look at the trends in cortisol. You're able to look at the testosterone, the metabolites. You're able to look at if they were, especially on birth control, and they got off of it and they've been off of it for at least a couple months. You can see some of the trends in their hormones. So it can absolutely be helpful if you have access to that. And if people don't have access to that, just some standard blood labs can still go a long way. Vitamin D, their A1C, their fasting insulin, their iron stores, running a full thyroid panel. I can't stress that enough, because women with PCOS are more likely to have some sort of thyroid condition or hypothyroidism. So just want to throw that in there while we talk about testing as well.
Okay. Mm-hmm. Okay. So why don't we talk a little bit about what are some of the, I guess, myths or big mistakes that are kind of impeding this whole treatment process for women struggling with PCOS?
Yeah. So, one of the biggest myths is that birth control regulates the cycle. So that's a common treatment approach to say, oh, your period's irregular because of PCOS, just take birth control until you want to get pregnant and come back. Again, that completely shuts down the communication between your different body systems. It doesn't regulate the cycle. It gives you a fake bleed. So, I think this could be more for like the client to understand, but if your client's on birth control for PCOS, just be receptive and say, hey, what else are you doing? Are you working on your nutrition, your lifestyle? Because we really want to address this from a root, not cover up the symptoms. Another big myth is that women with PCOS can't get pregnant. Women with PCOS can absolutely get pregnant. I see it all the time in my practice, and it's, I think, one of the most rewarding things to see is if somebody is really purposeful about motherhood, they're able to achieve that. So when you address the symptoms, you get to the root cause, you get an individual ovulating, get symptoms under control, pregnancy can definitely happen. So this kind of goes along with like symptoms. People believe they can never reverse their PCOS symptoms, like they're locked into that for the rest of their life. And that's not true. Again, there's this genetic component. So yeah, a client or female will always have to take care of themselves. But we can usually manage these symptoms really well. And we don't have to be victim to them any longer. And one last myth I want to share is you have to lose weight to balance PCOS. Not necessarily true, because PCOS exists. Weight loss isn't always what's most important. So look at the person as an individual, not just PCOS as a syndrome.
Oh, interesting. Okay. So in your treatment process then, do you tend to use supplements as well?
Yeah, I'm a big fan of supplements. It totally in moderation, depending on the person. But if somebody is insulin resistant, inositol is wonderful. The blend of Micro and D-Chiro can be a nice alternative, especially if females struggle with gut issues due to metformin. This is really common. So something for practitioners to know, and it's also not going to deplete different vitamins like metformin does. So I love inositol when appropriate. I love adaptogens when appropriate. If one of the root causes is this, cortisol, high stress, just depleted state. And then if we want to do a little further support, if we're looking at the Dutch and the hormones, there's some nice herbs for that. And again, some just standard labs, run their iron, run their vitamin D. Everybody I see in my clinic is vitamin D deficient. And maybe a little bit of thyroid support if appropriate. So yeah, we could go on about that. Gut support, probiotics. PCOS is a total body syndrome. That's what we need to understand. We can't isolate the reproductive system. We can't just look at insulin. We've got to look at thyroid, other markers, hormones, and then from there, supplements can be really supportive, especially if females don't feel good about the prescriptions they've been provided.
And I'll bet like insomnia is a real big problem too, right?
Yeah.
I'm guessing.
Yep.
Based on everything I'm hearing.
Yeah. And what happens when you sleep? You heal, right? So sleep support is a big one. Absolutely.
Right. Yeah. So let's see. Oh, actually, good. A really good question. So what diet plan or eating pattern do you use to support clients with PCOS? Oh, and then a great question about soy. The $1 million question, right?
Yeah. So for starters, in terms of nutrition support, my philosophy that I use in my clinic is whole, real, organic, fresh, seasonal when we can. And I do take a really balanced approach. So I do tell clients, focus on protein at every meal, not too much, because too much protein can impact blood sugar too, in a negative way. Really focus on adding in good fiber, good healthy fats. And I do advise to actually add a little bit of high quality carbohydrates, about a half a cup at lunch and dinner. That's pretty specific, but for blood sugar, insulin regulation, we want to keep carbs a little bit lower in the morning, but carbs aren't evil. And this is important for the mental state of your clients, because remember, put yourself in their shoes. If they've had weight gain or they're trying to balance their blood sugar and they're being told don't eat carbs, and then they're being told to continue doing that, it's really hard for these women, or for what I see clinically. So balance, I find, is the best. Some examples of high quality carbs that I like to use are sweet potato, lentils, any of your winter squash. I even educate clients about seasonal fruit. Some of the lower glycemic fruit is better, but if they want a half a cup of watermelon, it's like, just eat the watermelon with your protein. So pairing protein, fat, and fiber are essential. And whenever a client is having a carbohydrate, always make sure they're having a little protein or fat with it as well. So that's sort of like the plan or approach that I use. I do emphasize 3 meals a day. Intermittent fasting, we have to be careful, because these women's systems can get stressed out really easy. Too much fasting. If they have some hypothyroidism, if they're depleted, if they're stressed, fasting can stress the body out more. So it's a fine balance. I kind of like 12, 14 hours from dinner to breakfast, and then 3 meals a day and maybe a snack if appropriate. So I hope that's helpful in terms of eating pattern. I find soy, based on like what I've seen, a little bit of high quality organic non-GMO soy is okay. The reason being is because we're not seeing this crazy impact on estrogen. But what is pretty interesting is that women who like Asian women, for example, from descent, have been eating soy for a long time, right? And so the studies are showing that when women are eating this soy, but they have this genetic like predisposition for it, they tend to do better. So in the Western world, what I say is, have a little bit of it, but don't overdo it. So I hope that makes sense. I think soy is okay, but there is definitely this genetic component or ancestral component that we want to keep in mind with soy. But I think with honestly any food. So I try to keep, I try to keep balance. Yeah, people variety, but not restriction too.
And then I don't know. Did you talk a little bit about the GMO based soy?
Yeah.
So what are your thoughts around that?
Yeah, so totally like non-GMO. I really try to emphasize organic when possible. Avoid pesticides, because that can all be toxins or inflammation that can totally impact obviously your hormones. And how else could people be getting toxic exposure? Through plastics, non-toxic cookware. So part of the eating plan that I talk about. Yeah. What do you store your food in? How are you cooking your food? If they can't afford organic, can they wash their vegetables really well? So trying to really avoid toxic exposure too is a big part of the eating plan.
Okay.